Hi, I'm Jacob Schneider, and this is Jimena. This is my close friend. Just going to talk about substance abuse disorder, and at the very end, we're gonna have a little quiz. Okay?
Sounds good.
All right. So we're gonna be looking at this PowerPoint presentation that I made for her. Oops. Great start.
So excited.
All right. So you went to the meeting that we talked about SUD. So you have a little bit of a background, but I'm just going to talk to you a little bit more and give some resources for getting help. So just an introduction to SUD. I'm just talking about this with you so that I have people in my corner that are aware of the risk of SUD, so that people close to me know where to turn if they have a concern about me, and just to educate loved ones about the signs and symptoms of SUD. So just a little overview about what we're going to talk about. What SUD is, why CRNAs are at risk, some signs and symptoms of impairment, and just some resources available if you need assistance or have any concerns. And well, I said if you pass the quiz that I have for you that I would pay for dinner, but we already had dinner, so oops. All right, so what is SUD? The definition of SUD, according to the DSM-5, defines SUD as a disease of the brain characterized by the recurrent use of substances that cause clinical and functional impairment like health problems, disability, and failure to meet major responsibilities at work, school, or at home. So it involves a circuit of reward, withdrawal, memory, and motivation. And as far as addiction goes, that's the most severe and chronic state of SUD, where there's a loss of self-control and a compulsion to use substances like alcohol and drugs, even if it has significant impairment of your life, or if you have a desire to quit and you just can't stop. It's important to note that it's a disease, not a choice. Research strongly has supported this fact. It's a disease of the brain without a known cure. So because there's not a known cure of it at the moment, it's important just to recognize risk factors, and by knowing those and instilling adequate coping mechanisms, hopefully that can aid in preventing developing SUD. I also forgot to mention that JJ Jimena is a nurse practitioner student at UMKC, so along with being a really close friend, this is also important for her to learn about too, so we can kind of keep each other accountable. All right, so she's a healthcare professional too, and she works a lot in the emergency department. So obviously there's a risk of that for that profession, but also it's important for myself, because this video is about me, right? To recognize that there's an increased risk of SUD for SRNAs or CRNAs, and so it has been shown that up to 10% or 10 to 15% of all clinicians will misuse drugs or alcohol at some point in their career, and that so it's important to know that SUD can affect anyone, but professionals in the anesthesia community are at a very high risk of developing SUD. Research has shown that 1 out of every 10 CRNAs will be affected by addiction to either drugs or alcohol at some point in our career. Part of why they think that is because of the regular use of opioids, benzos, inhaled anesthetics, and other IV anesthetics on a regular basis. There are things in place that attempt to prevent the misuse of those drugs, like machines like Pyxis or other med stations, but there's obviously still ways to get around that and divert medications. And diversion definition is the transfer of any substance for the purpose from diversion of any substance that is not for the purpose for which it's intended for, specifically illicit use. So some of the other risk factors for sRNAs and cRNAs that put us at a high risk of SUD is depression and anxiety, addictive personality, low stress tolerance, personal history of alcohol or medication misuse, maladaptive coping mechanisms, trauma, abuse, stressful work, home, community, environment, family history of SUD and addiction, pain, both acute and chronic, fatigue, irregular work hours, and other specific work-related issues would be irregular work hours, unregulated and readily available access to things like propofol. And another thing that the AANA, the American Association of Nurse Anesthesiology, mentions is the sensitization of the effects of opioids and anesthetics, that sometimes anesthesia providers can kind of justify knowing so much about these medications that and their side effects that sometimes that can make people tempted to and justified to take them themselves. Right, next slide. So it's important for me to talk about some of the signs of SUD. These are just a few that I listed, but obviously as an anesthesia provider, being impaired on the job is really risky for me and my patients. So if you or any of my loved ones were to detect any of these things in me, I would hope that you would recognize them and speak up. But a few examples that I listed were mood swings, personality changes, becoming unreliable, and that's in terms of like tardiness, absences, elaborate excuses, things like that. Having a deteriorated appearance, if I'm starting to look ugly, just call me out on that. Weight changes, both weight loss or weight gain, memory loss, and one other thing that the ANA mentioned, which would be terrible, but is a sign, is being found unconscious or dead. Obviously, things like track marks, things like that are in addition to those other signs. So how to get help if you were to suspect myself or any other loved one would be struggling with SUD. There's some specific unique challenges for anesthesia providers that struggle with SUD, and that is that they may deal with the potential loss of the profession, professional and personal guilt and shame, and I kind of mentioned this a little bit earlier, but a tendency to intellectualize things, specifically in this case, the treatment process. So some things to be aware of as far as the treatment availability for anesthesia providers. The AANA recommends that the treatment specialties be approved by the State Board of Nursing, that they have appropriate neuropsychiatric testing, that there is medically supervised detox if indicated, that there's treatment for mental health comorbidities, that it's a long-term treatment plan that includes a 12-step model of sobriety, and that they're able to safely and appropriately evaluate the suitability for return to anesthesia practice. So I'm going to give you this card. It's a wallet-sized AANA hotline that you can call. It includes that phone number on there if you had any concerns about myself or anyone else in the healthcare community that maybe be struggling with substance abuse, and they'd be able to help you just kind of determine if there's an issue and kind of help you along in the process of that. Additionally, there's this AANA website that goes over, let's pull it up, the peer assistance for health and wellness. I'll show the screen. Okay. So I'm just going to kind of walk through this website briefly, and there's a lot of good resources on this. So let's click on getting help for yourself and others. So this includes, again, the phone number that is on that card, and then some other good resources about domestic violence and other things like that. And let's see, over to the side, there is more information about substance use disorder. And let's see, I found something earlier that I wanted to show you. Okay, so there's treatment recommendations, intervention essentials. If you click on that, it kind of talks about walking you through conducting a safe intervention.
Nice.
And other tips for that. For example, it says do not leave the individual alone or let them drive once the process is started. So that's high risk for self-harm. Crisis intervention essentials, self-harm and suicide risks, legal reporting. And then there were other links on here for like support groups and everything for like family members and friends of those that struggle with substance abuse. All right, well, there's a quiz that I had in the end of this that we can briefly run through. All right, name 3 potential observable signs of SUD. Go.
Okay, weight loss, not showing up at certain times, unreliable, and changes in behavior.
Nice. All right, what is one reason why anesthesia providers are at a higher risk of struggling with SUD?
They have easy access of those drugs.
Nice. What can you do if you suspect that a loved one is in healthcare is struggling with SUD?
I have a card that I can call to ask for help, and then there's also a website that I can use to look up ways to intervene.
Perfect. Here's some references. Since you passed, you're going to pay for my dinner tonight. All right. Thanks.
Thank you.